Good afternoon, everyone. We're live today at Sakra World Hospital. We have with us Dr. Anisha S. Tandon, who is a senior consultant and head radiology and imaging at Sakra World Hospital. Welcome, doctor.
Thank you, Dipti. So before we start, I'd just like to give a brief introduction of our Department of Radiology and Imaging. So we have a team of 4 radiologists, and I'll just talk a little bit about all of them. We have Dr. Shrikant Narayan Swami, who is a musculoskeletal and sports medicine specialist. So he basically is involved in diagnosing sports injuries, diagnosing as well as treating sports injuries and other orthopedic conditions. Then we have Dr. Dheeraj Tiwari, who is an interventional radiologist who is with us since the last 6 months, and he is involved in a lot of treatment-related procedures which involve radiology. We have Dr. Satish Kumar, who is a general radiologist, and all of us are. I am a pediatric radiologist. All of us are fellowship trained, and we are all trained in US and UK. So this is our department. And regarding the equipment, we have the state-of-the-art equipment in our Department of Radiology. Basically, we have a 3 Tesla MRI machine, which is the highest strength magnet there is. We have a 128 slice CT machine, which is a very advanced state-of-the-art machine. And as far as I'm aware, we have the only hybrid operation theater in Bangalore. So when I say hybrid, I mean that it has the ability to have fluoroscopic images on while the operation is going on and while the OT table is functional in the surgical procedure. So that is a hybrid equipment which is only available in Sakra World Hospital. So this is regarding all the state-of-the-art equipment, and of course, we are a one-stop shop for all radiological imaging modalities as well as therapeutic procedures. So that's about our department in brief.
Okay, so in today's session, it will help us understand the role and importance of radiology and imaging in healthcare. Now, here are a few questions. Could you give us an insight about what exactly a radiologist does?
Okay, so radiologist basically is involved in diagnosing medical conditions, diagnosing diseases, and we do that based on analyzing images. So now we obtain images of the patient either by doing an X-ray or an ultrasound or a CT scan or an MRI. And based on these images, we come to a diagnosis. We assess the images, we analyze for pathology, we analyze for whether there is something wrong, whether there is some growth where it should not be there, whether there are stones in the gallbladder, whether there are stones in the kidney. So basically, a medical doctor will have just a suspicion that a patient has any of these problems, and to prove those suspicions or to come to a diagnosis, finally, what is going on, we use various imaging technology and we interpret those images. So that is what a diagnostic radiologist does. As regards an interventional radiologist is involved in treating some of these conditions. So an interventional radiologist can actually open up blocks in major arteries. Suppose there is a block somewhere in the leg artery. Veins is another very good example, which basically which are not working. Those are treated by the interventional radiologist, either using laser or using balloons. So these are all various treatments. Just like a cardiologist or a heart specialist opens up blocks in the arteries of the heart, an interventional radiologist can open up blocks in other arteries in the rest of the body. So that is what is done by an interventional radiologist.
Okay, very nice. As a patient, can I walk in normally and get to see a radiologist like how we see other specialties?
So usually a doctor who has seen the patient before a radiologist will be referring the patient to the radiologist. For example, if you had back pain, you would go to an orthopedic doctor, or maybe you would go to a spine surgeon, and the spine surgeon would say, okay, you have back pain, but I don't know exactly why you have back pain. Is it because of muscle strain? Is it because of a disc problem? Is it because of some infection? And to diagnose what is going on, that doctor will send Deepti to the radiologist, and that's when she will come and walk in, and she will tell us that I need an MRI because I need to know what's going on. So that's how we get patients walk into us. They are meeting with another doctor, they would meet with a orthopedic surgeon, they would meet with a spine surgeon, they would meet with a gastroenterologist who would say, oh, maybe you have stones in your gallbladder, let's go and get an ultrasound done. So that's how you will come. And of course, the other way is if the patient has been already seen in another hospital or in another clinic and feels that they need to get the best of imaging done or the best of MRI done, because this is a 3 Tesla magnet which is not available in another hospital, then they would directly come and meet with us as radiologists and request for an imaging study.
Okay.
So that's how they would walk in.
So in that case, then we take a prior appointment and then
Yes.
meet you with
exactly.
our reports.
Yeah. So most of our tests would not require, like for example, a simple X-ray or an ultrasound will usually not require a prior appointment, since they are easily conductible tests. They are not time consuming. So they would walk in and we would get it done. But for something like an MRI, a prior appointment is usually required.
Okay. So what are the various tests or equipment that radiologists are experts of?
So so basically we have starting from the very humble X-ray, which all of you know, as you would have got some or the other X-ray in your life. So that's one of our major equipment. X-rays, we get X-rays done for a health check. We get X-rays done for fractures. We get X-rays done for back pain, spine injury, etc. Then we have the ultrasound. An ultrasound is done also now routinely part of the health check. So an ultrasound is done to assess all the internal organs of the body, usually the abdominal organs like the liver, the kidneys, the gallbladder, uterus, etc. For female like gynecological issues, now ultrasound is the most important imaging modality before anything else. So that's ultrasound, and then of course we have CT scan and MRIs. These are slightly advanced imaging technologies. Not everybody will get a CT scan, but of course, when there is a specific question which needs to be answered, like for example, is there a kidney stone? Is there a stone blocking the duct between the kidney and the bladder? Is there any tumor? Is there any cancer? Is there anything else going on, like lymph nodes or bowel disease? All of that would require a CT scan. And of course, chest diseases, which are really very long term, not responding, we cannot diagnose something on the X-ray, then they would get a CT scan of the chest. Then we would get a CT scan of the head if there's a head injury, like a patient is in an accident. Then to understand what is going on inside the brain, then a CT scan is done. And then we have the MRI. And MRI is a highly specialized imaging modality, and that is usually done for from the head to toe. We can diagnose many things on MRI, including strokes, including lumbar spine pathologies, very musculoskeletal pathologies. Orthopedicians will be referring patients for MRIs of the knee joints, of various joints. And of course, we have MRI of the abdomen also, to understand the liver, to understand pancreas. So all of these things would require an MRI. So these are all the equipments that we have, and which we are usually experts of, and we are reporting on a daily basis.
Okay. Are there any precautions that patients should take before going in for any of these tests?
So yeah, that's a good question. So most of the times for X-ray, for a simple X-ray, there is no precaution. For ultrasound of the abdomen, we usually ask the patients to be fasting. We usually ask the patients to drink a lot of water. So this is a little confusing for patients when they say that you asked us to be fasting, but you're asking us to drink water. So when we say fasting, we mean fasting for solid foods, so that we get clear vision and we don't have any food material obscuring whatever we are trying to see inside the abdomen. But we still need water, because water will fill up the urinary bladder and we need certain information from that. So fasting, but with drinking lots of water. That is a general instruction for ultrasound of the abdomen. Of course, for ultrasound of other parts of the body, like for example the thyroid gland or joints, there is no preparation which is usually required. So the patient can walk in and get any of those ultrasounds. Then for a CT scan, we have certain precautions like fasting, which is at least 2 to 3 hours. And then of course the patient's kidney function should be normal, because what we do during a CT scan is we give a little bit of an injection, which is a dye which goes inside the body, and that dye should not harm the patient's kidneys. So we need the kidneys to be normal. So
generally, you advise a creatinine report before you.
So we advise a serum creatinine report. And if the patients have a serum creatinine report done within the last 3 months, then that is all we need for a CT scan. And of course, we ask for history of allergies, because that before administering any injection or any drug, we should have that history available. And for an MRI, the only most important precaution is that there should be no metallic objects in the patient's body. And when I say metallic objects, of course, there are many safe metallic objects which are nowadays used, which are all titanium based. So now whatever implants are there in the body, like whatever has been put for a fracture, or suppose a heart valve has been put, or even an aneurysm clip aneurysm coil that has been put, those are all usually safe for MRI, the ones which are all newly used. But something which was placed, say, 20, 25 years ago, there is a chance that it is not safe in the MRI machine. And it is very important for us to ask the patients when that was done and whether there is any metal in the body. And this is regarding metal which has been placed by medical procedures. Of course, the patient should not have any coins or should not have their credit cards, anything magnetic should not be there in the body, on the body, or with the patient while they are going for an MRI. So these are certain common precautions which we advise before radiological procedures.
Yes, I remember there was a pacemaker which was installed for my father-in-law. That was an MRI compatible pacemaker.
Yes. So. Yeah, so that is, like she said, it was MRI compatible. So that is a question that we need to figure out from the patient. They will have all the data available with them. What kind of pacemaker has been put, what kind of device has been implanted, say, in their bone. And once we check that, then we are okay. But that has to be found out before.
Yeah. So it comes with a set of instructions,
yes,
I guess,
exactly.
before you get it. Since you're a pediatric radiologist, are there any special preparations or precautions for children who come for radiological tests?
So now children, it's very difficult to explain to a child that you have to not eat and you have to drink this much water, etc. So usually what we do is we don't enforce so many of the precautions for children, especially regarding fasting. So we would accept children who have not eaten anything for, say, 1 to 2 hours. Even if we get 1 to 2 hours of fasting for children, it is fine. And it is difficult to have a child cooperate for the entire long study of an ultrasound. So what we try to do is we try to make it as fast as possible. We try to have the parents inside with the child. We try to have the parents showing the child some video, etc. So we try to make a very friendly atmosphere so that it's not a very scary thing for a child to have an ultrasound. And of course, for tests like CT scan and MRI, we also luckily we have in our hospital a pediatric anesthetist, so Dr. Shishir Chandrasekhar. So he is available 24/7 and he provides full support for us to get children for CT scan and MRI by giving them some sedation, etc. So that is another added advantage that we have at Sakra. We have a pediatric anesthetist. We have all the equipment in our CT and MRI rooms so that the child can easily get the scan done without any complications.
I have seen these boards which say that if you're expecting a child, then do let us know because of the radiation. So is there a concern regarding radiation since there is exposure to X-rays?
Of course. So this is a very good question, especially for, like Deepti has put it, especially for female patients. It is very imperative for us to know exactly the menstrual cycle of the female patient, what exactly is going on. Is there a chance that she could be pregnant or that she is planning for a pregnancy? So based on certain questions and certain criteria, we decide when is it safe for a patient to undergo anything like an X-ray or a CT scan. For example, an X-ray or a CT scan should not be done if the patient has just had the period within the last 10 days. So that is a safe period that we decide that when can the X-ray or the CT scan be done. If there is any chance that it is not a safe period, then we can postpone it by a few days and get that scan done. So that is regarding female patients. But it's a very important question regarding radiation exposure. Nowadays, because we have very well-read patient population, we have everyone who has access to all data. This is a very common question that they ask regarding radiation. And with the present equipment that we have, there is a very, very low dose of radiation that we are using with our present equipment.
Okay.
And if we compare what background radiation people receive in general from, say, the sunlight or ultraviolet light, that radiation is much more actually than what radiation is there with the CT scan or an X-ray.
Okay.
So they are very safe. Of course, in certain situations, we have to assess, like for a very small child or for a lady who might be pregnant, then we have to use some alternative imaging. For example, an ultrasound or an MRI, and not an X-ray or a CT scan.
Okay. Are there any side effects of undergoing radiological procedures?
So basically, we've already dealt with the question of radiation. So radiation, like I said, is very negligible, and what we have in the latest equipment treatment, we can even reduce the dose to such an extent that there will be no effect at all regarding radiation. But there are certain changes that may occur based on giving the dye that I spoke about. So we have, for example, during CT scan, we have to give an injection of a contrast agent or a dye, for which we need the serum creatinine report, which we have already covered. But other than that, the patients could be allergic to those dyes, and we have a proper set of questions which we ask to every patient before we give that dye, about history of allergy, about what was the degree of allergy to certain things. And if there was a history of allergy, we give pre-medication. We give something before giving the contrast so that there will be no effect of that contrast. Okay. And if at all there are certain effects, we are well equipped to deal with those effects. We observe the patients for 1 to 2 hours after the CT scan, and then we deal with all the allergic effects that may occur. And this is a very small percentage of patients which have these kind of reactions. Most patients will be quite okay with all the contrast that we give.
Okay. Sometimes, even after performing the radiological tests, the diagnosis is not arrived at. Is that possible?
So yeah, this is a question that we have very often from patients, that we've done so many tests and we still don't know what is going on. So you have to understand that there are diseases in the human body which all of which do not show up on images. So for example, suppose you are allergic to milk, and then every time you have milk, you get some form of diarrhea. So suppose we do any sort of test for that, like an ultrasound or a CT scan, it may not show anything, because that is something which is happening at a molecular or a cellular level. So we may not see anything on an image. Or for example, suppose you have some degree of acidity. So all that you may have is some small mucosal erosions, which will be seen on an endoscopy test. It will not be seen on an ultrasound. It will not be seen on CT scan, MRI. So all of these tests are normal. So even getting a normal ultrasound, CT and MRI is a very good thing, because we know that, okay, so now we may have to deal with something else that is going on, which we may need to do some blood test, which will give the diagnosis. We may need to do an endoscopic test, which may yield the diagnosis. We may need to check for some allergies. So everything need not come up as like a tumor or a stone or something on an image. There may be so many diseases which have other tests which give the diagnosis. And of course, even suppose we have diagnosed a tumor, for example, in some patient, we may not be able to tell what exactly it is. For that, we finally need a biopsy, we finally need a pathologist, we need a surgeon. So we have this whole team which takes care of certain things. And we may only be a guide that this is where the tumor is. You need to be safe in terms of this organ and that organ. Otherwise, the rest of the diagnosis will have to be provided by the other specialists.
Okay. So that was a very informative session. Thank you, Dr. Anisha. With this, we are wrapping today's session. If there are any questions, leave it in the comment section. Our experts will revert back.